Hello and welcome to my channel. In today's video, we will discuss about a very interesting topic, that is GNM concept about COPD, bronchitis and pneumonia. So what is the basic theme behind these mucosal respiratory diseases? So we will basically discuss the GNM concept behind mucosal respiratory disorders, or you can say diseases. So let's talk about it. So first of all, I would like to discuss development and functions of the bronchial mucosa. Let's talk about it. So the bronchial tubes branches from the trachea into two main bronchi, from where they subdivide in the cell of the bronchi, and the bronchioles is to carry air into the lungs alveoli, where oxygen and carbon dioxide are exchanged during respiration. The bronchial mucosa consists of squamous epithelial and which originates from the ectoderm and is therefore controlled from the cerebral cortex. Now next we will discuss about the brain level of bronchial mucosa, that what is the relation of the bronchial mucosa with brain. Let's talk about the brain level. The bronchial mucosa of both the lungs is controlled from the right temporal lobe, which is a part of the sensory cortex, and the control center is positioned exactly across from the brain relay of the laryngeal mucosa. So this is a brain level concept of the. Now we will discuss biological conflict. This is an important topic here that we are going to discuss now. So biological conflict. So the biological conflict linked to the bronchial mucosa is male territorial fear conflict or female scare fright conflict. So depending on a person's gender, laterality and hormone status, the male territorial fear conflict is the equivalent to the female nest worry conflict. In fact, originally Dr. Hammer termed the bronchi-related DHS a territorial worry conflict. So here we are trying to say that the main conflict behind mucosal respiratory disorders or the disease is territorial worry conflict, or you can say scare fright conflict. Okay, so next, as you can see here, we have provided a picture. Here we will try to understand what is territorial fear conflict. So let's talk about it in an elaborated manner so that it become understandable to you. So let's talk about it. So a territorial fear conflict refers to a threat to the territory, or fear within the territory, at home, at work, at school, at the playground, in kindergarten, in a senior home, in the hospital, in the village, in the city or country where one lives, and to a fear regarding one's own safety as well as the safety of the pack. Physical abuse, family violence, mobbing, bullying, an accident, fire or flooding, an acute medical condition, a hospitalization are a few examples of what can trigger this conflict. Children suffer the conflict when they are punished, they are abused or yelled at, when they are terrified of a person or a situation, when they watch spooky films or videos showing monsters or vampires, or when they have nightmares. An adult's panic can also create a territorial fear in a child. Unborn children experiences the conflict in the womb of the mother, when the mother is in danger or at birth. Conflict could also concern a member of the territory, that is a fear of losing a partner who secure a home, or when a loved one is seriously ill, hospitalized or diagnosed with cancer associated with a fatal disease. So this is exactly territorial fear conflict. I hope this is clear to you. So this was all about the biological conflict behind mucosal respiratory disorders like COPD, bronchitis, or you can say pneumonia. Okay. Now move to next. This was the first. Now next we'll talk about the conflict active phase. So what happened during conflict active phase? So during this phase, ulceration in the bronchial mucosa proportional to the degree of the lungs serves to facilitate a conflict resolution. There are no symptoms in the conflict active phase. Now the next phase is healing phase. So what happened in the healing phase? Let's talk about it. So during the first part of the healing phase, the tissue loss is replenished through cell proliferation, healing symptoms, and pain due to swelling caused by edema, that is fluid accumulation, tickles in the lungs, that is itching, or the pruritus is characteristics for any healing involving squamous epithelial tissues such as skin, and coughing. Coughing facilitate bringing up phlegm containing remnants of the repair processes. So depending on the intensity of the conflict, after the epithelial crisis in the swelling recedes and the function of the bronchis returns to the normal. Now one by one we'll talk about the mucosal respiratory disorders, that what is the basic theme behind COPD, bronchitis and pneumonia according to German New Medicine, okay, GNM. So first of all, we'll talk about COPD. So the swelling in the bronchial tubes can block the air passages, resulting in a bronchial atelectasis. On the lung X-ray, the bronchus, void of air due to the obstruction, appear as white. After the epithelial crisis, the bronchial tube reopens, accompanied by heavy cough and sputum production. However, with the hanging healing, when the repair process is continually interrupted by the conflict relapses, the scar buildup eventually hardens, with the result that the atelectasis remains. And this is referred to as COPD, that is chronic obstructive pulmonary disease. The bronchial constrictions causing permanent breathing difficulties even after the healing phase has been completed. Now bronchitis. So bronchitis occur when healing is accompanied by an inflammation, typically with fever, headaches, because of the swelling in the corresponding brain villi, and fatigue since the autonomic nervous system is in a state of prolonged rest. In conventional medicine, recurring bronchitis is generally associated with allergies, that is bronchial asthma, with water retention as a result of an active abandonment and existence conflict involving the kidney collecting tubules. Bacterial pneumonia indicates that the repair and the scarring process is assisted by bacteria. This is usually the case when the ulceration takes place in the conflict active phase, reaches deep into the bronchial tissues, and that purposely caused by Spanish flu pandemic after the First World. So at last, I only want to say that scare, fright, conflict is the main cause which is behind the mucosal respiratory disorders of the lungs. And they can be COPD, they can be pneumonia, they can be bronchitis. Okay, so according to GNM concept, scare, fright, conflict is the main cause behind mucosal respiratory disorders. In this video, we have discussed about a GNM concept about the mucosal respiratory disorders like COPD, bronchitis, and pneumonia. In this video, we have talked about the conflict active phase, healing phase, and biological conflict. And at last, we have talked about the territorial fear conflict, about the mucosal respiratory disorders. So that's all for today. See you guys in our next video. Till then, stay connected with us for more videos like this. Don't forget to subscribe and comment below, and yes, press the bell icon for more updates. Stay safe and stay healthy, and yes, thanks for watching this video.